When is it time to get my hip replaced? Well, you get your hip replaced when you have hip pain due to arthritis substantially limiting your activities of daily living. You're changing your activities because of the hip pain. It's keeping you up at night. The hip is giving way and you think you might fall, or some other indicator that it's really changing your everyday life. That's when you consider getting the hip replaced. We are fine with conservative treatments for hip arthritis, but things like injections and physical therapy don't tend to work as well for hip arthritis as they work for knee or shoulder arthritis, for instance. And so the many times when patients come to us with hip arthritis, they progress to needing surgery quicker than with other joints, unfortunately. So hip replacement surgery involves replacing both the ball and socket portion of the hip joint. And so I have some real hip implants here, and a hip replacement on the ball side of the ball and socket joint consists of a stem, which is made of titanium that goes down into the femur bone and supports the ball on top. In the United States nowadays, the ball part of the ball and socket joint is most of the time made of an alumina and zirconia composite. So it's a ceramic composite that is very strong and very low friction. On the socket side, you have a titanium socket that interfaces with the bone, and then lining that titanium socket is a polyethylene insert. So what actually rubs together the majority of times here in the United States is a ceramic head ball that rubs against a polyethylene plastic liner. And then what actually meets up with the bone are titanium implants. There's multiple different ways to approach or to surgically get to the ball and socket joint to replace it. We are big proponents here of the anterior approach, which is approaching the hip from the front of the hip. The advantage of this is that you can get to the hip through the front of the hip without cutting any muscle. That slightly improves the recovery time after surgery relative to the approaches from the side of the hip. But there's some other advantages that we are really fond of. Number one, the patients are supine or flat on their back during the surgery, so we can compare the leg lengths directly and really dial in those leg lengths to be as close to being equal as possible. In addition, the patients, when they're flat on the back, we can take very accurate x-rays during the surgery of the hip replacement implants to make sure that those implants are in the exact position that we want them. Third, because we don't disrupt any of the tissues on the back of the hip is very resistant to dislocation. And relative to the older way that I used to do hip replacement 15 years ago, where we would go through the back of the hip, the anterior hip replacement, the hips have a very low dislocation rate, 10 times less than a posterior approach. The biggest risks in the United States for hip replacement surgery are dislocation, where the hip pops out of joint, infection, and leg length discrepancy. And the way that we do the hip replacements at St. Joseph's, through an anterior approach to the hip, really limits these types of complications that you can get after surgery. So many patients ask, what am I going to be able to do after the hip replacement surgery? Am I going to have any limitations? And the answer is that for most patients, they won't have any limitations. They'll be able to do any activity that they feel that they can do. To give you some numbers, when you ask patients a year after surgery, what is your hip replacement relative to an 18-year-old's hip? On average, hip replacement patients will tell us that their hip replacement is 90% of an 18-year-old's hip. So not perfect, but worlds better than what they started with from a functional standpoint. So hip replacements have a 1% per year failure rate. So after 20 years, you have a 20% chance of having the hip redone. Patients used to be told, well, the hip replacement's only going to last you around 10 to 15 years, and that's not true. If you think about those numbers as glass half full, you have an 80% chance after 20 years of not having the hip redone. And so the hip replacement implants last a very long time.